I'd like for everyone to think for a moment about the value of human life. And does one person's life have any more value than another person's? The current fee-for-service healthcare system rations out care based on the patient's ability to pay. I believe this is unethical. It is criminal. 95% of the country is still functioning on this fee-for-service model. I believe everyone should be treated the same. Everyone should have access to primary care regardless of their ability to pay. Hi, I'm Dr. Faisel Syed. Welcome to another episode of Faisel and Friends. We're here because everyone deserves access to quality primary care, and ChenMed needs physicians to take care of them. Today's topic is COVID, hope on the horizon. This is our last episode that we're doing for 2020. We'll see you back again in the first week or so of January. Let's get started. Dr. Dan.
How are you this evening?
Oh my gosh, I'm having one of those weeks where every day feels like a week.
Yes, that's right. That's right.
It was your idea to end off the year with a message of hope. What perfect timing with the vaccines being administered. The vaccines here in Tampa are being administered
right
through Tampa General Hospital. In Richmond, who's doing it over in Richmond?
I know that HCA is. I got an email that Bon Secours has them. I know VCU was planning on starting this week. So, yeah, I thought this was a good topic to end the year on because there is some hope, and I think we're lucky that we have one of our experts from ChenMed who's helped guide us through this. So I'm excited.
Yeah. This year has been fast and slow, a lot of fast and slow. When I think about where we were last year when we first started hearing about this virus coming from China to where we are today and everything that's happened in between. I mean, what a roller coaster of a year it's been. So I'm excited. We have our Dr. Jason Lane joining us tonight. Dr. Jason Lane. Jason, thank you so much for joining us.
Great to be here. Thanks for having me.
Jason, Dr. Dan refers to you as ChenMed's best kept secret.
I try to keep a low profile, I guess.
So Jason trained under Dr. Anthony Fauci himself.
That is a claim to fame, yeah.
and last year, I'd like to before we get into some of the questions that people have about the COVID vaccine and maybe vaccines in general. I mean, you just never know what's going to happen whenever we go live. Sometimes, you just never know what direction it goes. I'd like to just kind of set the tone. I mean, we have centers across the country. We find out about this virus that's particularly deadly with the senior population. That's our world. And we're not fee for service. We are full risk, value-based care model, where the main drivers of cost are unnecessary hospitalizations. What were some of the thoughts that you had going on in your mind prior to something like this? I mean, we as a company were just think about how aggressive and how we are with just friendly competition with the flu, with flu vaccinations across the company. What were some of your thoughts in the beginning?
Well, it's kind of hard to remember all the way back to January. But as this started to hit in January, we were full on working really hard to get our patients vaccinated for the flu. That's very important to us. And that's something I take very seriously. So I remember when I first started reading about what was then called novel coronavirus, I sent some emails out across the org that I would be embarrassed to unearth now, but I'm going to unearth them, where I was encouraging people to keep their eye on the real threat, which was flu at the time. Make sure we kept vaccinating folks and we keep them informed about this coronavirus. That was January. By February, though, first or second week in February, we started to grasp how serious the situation was and started to make some plans. And I thought that we were staying ahead of the game, right? We started to plan on how we might pivot to telemedicine mid-February. well before anybody was thinking that. We started to make some other plans that, we're pretty involved. But the thing about it is it moved so fast. Every time we thought we were a week or two ahead, we ended up a week or two behind. So that's the speed at which it swept across the country in late February through March, was kind of shocking. But thank goodness we had been planning, and we made the pivot to telemedicine, I think, quickly, like over a weekend, right? That's one of the amazing things about working here is when we put our mind to it, we can move fast. So we pivoted from never doing it to full bore pretty much over a weekend. And we were probably a week or two ahead of when most other organizations started to make that change. And a week or two doesn't sound like a lot of time, but it actually, I think, turned out to be really important to be where we were with that. And then from then, it's just been it's been quite a ride the last 10, 11 months going through this journey. And now it is super exciting to get to talk about some really positive stuff with the vaccine.
So Jason, this is, I've just wondered about this because used to working in a large health system, we always there were all these things that we prepared for. We would do these tabletop exercises and get ready for, I remember getting ready for the H1N1 pandemic, although that's a little bit, that almost seems laughable to have called that a pandemic at this point. But I just wonder how many of these disasters do you get ready for in a year, or was this truly unique? Because it just seemed like you were right on top of it, and in retrospect, I'm wondering, were you just always that prepared for something like this, or was this truly unique?
Kind of both. You mentioned H1N1, which true, it turned out to be something of a nothing burger. I mean, it was true. I mean, it was a pandemic, but it didn't turn out to be that severe. But I think something that helped prepare me for COVID was being in the thick of it during H1N1. I was in the Air Force in California at the time, in infection prevention and control, and worked closely with the state there when it first hit. And it was frightening at first because we were concerned that it could be the big one. And we went through a lot of the plans that we put in place for COVID here. So I kind of had that playbook to rely on. And then another one we went through, my first week here at working at ChenMed back in 2014 was when Ebola started to become a thing outside of Africa. It was right around the time that there were a single-digit number of cases that were imported into the U.S. and people really started to get concerned about it. So we went through the exercise of putting all these plans in place in case it was something that we really had to deal with. And so we had those ready to dust off. And then there was also, Zika virus in South Florida. We kind of went through the same thing. So it would be nice if I could say that I was proactive enough that I planned for it every year. That's not the case. But we did have these other experiences to rely on and some plans in place for that stuff that we were able to dust off and update for COVID.
Yeah. I mean, it was obvious that you had planned for something before because it seemed you seemed you never seemed to be flustered by it. The rest of us were running around pretty crazy at times. But, it was great to have you doing that. So there's Charlene has a question. What platform did you initially use for telemedicine?
Well, so we about the first week, it was truly telemedicine, right? We were doing telephone visits. But then we quickly started to just use, FaceTime, WhatsApp. Was it Google Duo? That's not one I've actually used. But then we also, at the same time, we're developing our own internal service that links to our own EMR. So I think we got that online within about a month or so from scratch. We were lucky that the regulations allowed us to use the apps and FaceTime and whatnot at first. So we made heavy use of that at first, but then quickly built our own tool that was integrated with our EMR.
Yeah.
I remember those. One of the things from those days. I have always been one of those people who did not believe in the telemedicine and the virtual visits. Like that you got to check the blood pressure. I mean, even checking the blood pressure manually and, making sure it's all done properly. And I'm a big fan of doing things in person. And I remember in the first couple days of doing the telephone visits, where, especially with dealing with like the patients that had like an acute situation, it sort of took me back to when I was an intern or when I was back in residency and having to triage and just react to several phone calls that we'd get over the night in like a 400 plus bed hospital. And I thought in that moment, I said, boy, we can do a lot of medicine like this over the phone. And then when you add the video, and these days FaceTime is secured, and as long as both of the users are tight, all that communication is secure communication. And then that was just a whole different level of communication with the patients. And in fact, with our patients, I learned that many of the patients they only FaceTime with their grandchildren. So as their doctor, when they started communicating with me via FaceTime, it suddenly became like a very intimate sort of relationship. They were showing me the fridge, showing me other parts of their home. And it made me into a believer of not just one, like Dr. Dan, you always say to me, does it always have to be either or? Can it be, both and that's sort of my experience. And I feel like that kind of spread around the company. I remember it was within a week that everyone embraced. We went from over 90% in person to over 90% telemedicine visits.
Yeah, and the patients loved it too. Our satisfaction scores associated with it were really high. And what I also see patients in clinic, and what I've found is, I still have some patients who really prefer to stick to in the center as much as possible. I have a lot who prefer to mix it up. I have a lot who prefer the convenience of alternating between in person and video. And I found it even today to be really useful for acute issues. There was a patient who, I really needed to see what was going on with the complaint. It was a finger problem, but there was no way they were going to come into the center. But I was able to look at it over, in high definition over the phone, and it made, a world of difference. So it's been a nice tool.
Yeah. So there was actually a question we got in advance from Katie, who said, I'm curious about how ChenMed continued to offer its patients personal care during the pandemic, communicating different types of risks to each patient and alleviating anxiety about the uncertainty, and how they plan to ensure that each patient gets the vaccine that's best for them. So, I know we flexed up and flexed down with telemedicine. So what was your, the thumbnail sketch of how we did that?
Yeah, so folks in this call have probably heard a little bit about our model, right? We're very high touch, kind of like concierge medicine for for lower socioeconomic seniors, which is beautiful. We were committed to maintaining that as we pivoted, right? And so one of our ideas was ensuring that we touch each patient at least once a week, right? Of course, that would mean, touch means contact. So we started this thing called love calls, right? So we made sure that every patient who wasn't getting some other type of visit that week would get a love call from a team member. Could be a doctor, could be one of the support staff. Our drivers weren't driving patients anymore, so we enlisted our drivers to make love calls. It was all hands on deck. And then we wrote specific scripts. So some specific messages about COVID, about how to stay safe, about alleviating anxiety, about when to contact your doctor because you might need a test. Early on, when tests were even available, like others, we didn't have testing available at first, so we had to explain that and explain, when you want to call your doctor to see if you need to seek out a test somewhere else. So the love calls were really good, and what we've done throughout the pandemic is we've devised a system of coding based on COVID activity, right? So depending on what the COVID activity is in each market, we either ramp up or ramp down the tele and video medicine versus on-site. And as we ramp up the tele and video medicine, and some folks don't have as much of the regular jobs to do, we also ramp up those love calls. And then we've been also writing new scripts depending on what the needs are at the time.
That's another incredible thing that happened during those first several weeks, or even the first month or two, I was reading about primary care offices laying off staff. I mean, hospital systems laying off employees, doctors getting pay cuts across the board of 10, 15, 20%, doctors getting furloughed. And I don't believe that any of our staff were negatively impacted from any of that. In fact, we kept finding work for people to do.
We found plenty of work, right? I mean, we believe in the power of connection with the patients, and there's always more ways to connect. Another thing that I think I'm really proud of, you said, our employees didn't suffer. When folks had to be quarantined, or even when there were issues with, kids being out of school and having to be home, we found ways to make sure they could contribute remotely, right? Whether it was quarantine or isolation because they did have a mild case or stuff like that, we still found ways to make sure that they were contributing and also kept whole throughout it. So I think, the support there, I'm sure, was really important because this has been a stressful time for everybody.
And I think it's probably a good opportunity to point out here that part of what allowed us to do that was being part of the full risk or full value model that we like to talk about, is because we get paid to take care of our patients, not how many times we see them. And therefore, we weren't scrambling to worry about generating just office visits. We wanted to provide the care in the safest location for them to keep them as safe as possible. And as long as we could keep them healthy and out of the hospital, we were going to do fine financially.
Right. The only way it hurt us is if we didn't keep our patients healthy.
That's right.
Because
my dad is one of the ChenMed patients. He's a patient of Dr. Guwalas in North Tampa. And I'll never forget, it was our last event. It was our last event in Baton Rouge, Louisiana. And I was on my way to the airport heading back to Tampa. And there was so much in the news about, there was so much confusion. This is back in February. And he called me saying, "Hey, don't worry about what you're hearing on the news. I spoke with my doctor, and my doctor told me that as long as I stay home, I'll be okay. And if I go out, to be mindful about what I'm touching, wear a mask, keep a distance, and just be mindful, and everything will be just fine." So he said, we just got to just lay low and trust me. My doctor told me. And I said, "Okay, Dad, thank you so much." I was in a panic. I was worried about him. My father's 70 years old. He's got multiple medical conditions. And we have my children. He lives 10 minutes from me, and I had 3 boys who were bouncing back and forth between our 2 homes. And I was just so worried about this virus that's spreading. But he felt peace of mind because of the relationship he continues to have with his doctor and the entire care team at the center.
It also made me think of, our driving theme that we came up with early on was healthy, happy, and home, right? So we knew that, despite all the everyone was arguing over various treatments early on, we knew that what was important was making sure our patients knew what simple things to do, and to keep them healthy and happy. We needed to encourage them to stay home. So one other thing that we did is we started med delivery so that they didn't have to go out to get their meds. And, for a population that's at super high risk, if they do get exposed to COVID, that's a big deal. So.
Right. Absolutely. I mean, we even, I remember early on, Chris is the chief executive officer of the company, told us if we needed to use company funds to buy toilet paper, not to let our needy seniors to be out schlepping around Walmart looking for toilet paper. So I know everybody wants to talk about the vaccine, and so it's probably obvious, but somebody asked us, "I'm curious if you began planning for its dissemination among your patients before its approval." And I know the answer to that question, but if so, how have those plans adjusted now that it has been approved?
So, yeah, we did start planning. It's been difficult because even now that there's 1, soon to be 2 under emergency use authorization, we don't know which one we're going to be offered. We don't know when we're going to be offered it, and we don't know, how much will be offered. So that makes planning difficult, but we're tracking down every possibility anyway. So we've got we got one team in contact with the health systems that are receiving early shipments to figure out how we can work with them to get our healthcare providers and patients vaccinated when they start offering it to others. Same with the pharmacies and health departments. And then we're also registering every center with the CDC and the state health departments and upgrading our cold storage so that when the time comes that we are offered the vaccine to disseminate ourselves, we're ready. We understand that some of this work might not result in ultimately us being able to execute something, but we're sure that one of these work streams will. So we're going to pursue them all and make sure that we're ready with whatever is offered to us.
And then Mary from Landmark Health, and they take care of a needy population similar to ours. I think they focus on the elderly. Is asking, with the vaccine becoming widely available in 2021, how will you ease the fears of patients to promote vaccination? I mean, I think that's what we worry more about, is actually convincing people to take it. I mean, once it starts flowing, we really want to make sure we're able to get people to take it.
Yeah, well, we kind of have a test audience for that, and that's our own staff. Because vaccine hesitancy right now isn't just in seniors and patients; it's nationwide, and it's unfortunate. We've been really deliberate with messaging to staff. We have town hall type events at least once a week where everybody can ask questions, and we provide the latest information. And we're working on similar messaging for patients. And we've done a lot of work with this with flu vaccine. We've improved our vaccination rates by, I think, an absolute of about 30 percentage points over the last 3 years. And our general approach is just really kind of transparent honesty. With our staff, we're very transparent about what we know about the vaccines, which at this point is very positive, but also transparent about what we don't know. And we explain what they're hearing about in the news that leads some people to have concerns. And I guess we trust their own level of reasoning and thought, and just open ourselves up to to take all their questions and answer the best we can.
I must say that probably my personal biggest frustration, if I had to pick one single frustration, was just the sheer amount of misinformation being spread about the virus itself. And I think I was so concerned. I mean, I'm very optimistic now, but initially I was very, very concerned just with the way the country has responded in general to flu vaccination rates across the country. I mean, we can't seem to cross the 50% mark with adults getting vaccinated against the flu. And so I was very worried about how people would respond to the COVID vaccine. But from what I'm seeing, at least over the last couple of days, at least I'm feeling very optimistic. I think people are just ready to move forward with life. I mean, this is not the flu.
Yeah, I'm still both anecdotally and in polls and stuff seeing a lot of hesitancy. But to go back to the previous question about how we approach it with our patients, I'll also go back. What we found with flu, I think, was making sure our staff were bought into it led to our patients being bought into it. So I think that's another reason why we're really starting with our staff, to make sure that those people who have the connections with the patients, not just the doctors, but our care promoters who are MAs and nurses, our front desk staff, everyone, our drivers even, are believers in the vaccine and have gotten it themselves. And if our experience with flu with that holds, as our staff buys in, the patients will follow.
So there's one question here, and I've heard other people some people are concerned about the mRNA. You're putting genetic material into me. Although I guess every time we eat a hamburger, we're eating genetic material too. But then somebody here also asked about, is Bell's palsy a side effect of the vaccine? So what do you think about the safety of the vaccine and the trials that have been done? They've been done quickly, but they seem to be rather large trials that have a lot of science behind them. But I mean, you're the expert in infectious disease and have studied this. What are your thoughts about this?
Yeah, so I was just looking at these numbers today on the numbers of patients studied. 43,000 in Pfizer, over 30,000 in Moderna, so over 70,000 so far. There was a high-dose flu vaccine that was just published, randomized trial that had 5,000 patients in it. And the Sentinel high-dose flu vaccine study had 30,000. So these are really good numbers of patients studied. They didn't cut corners on that at all. And that will be very good at picking up any short-term safety issues. And most safety concerns with vaccines do come up in the short term. Of course, I get asked all the time, well, could there be anything that happens in 2 years? And I have to answer, well, we don't know that for sure yet. We're not going to know for sure, for 2 years. But when I look at this, I haven't had COVID, thankfully. I am certain that if I don't get the vaccine within 2 years, I'll get COVID, and my risk of having a bad outcome, far outweighs any unidentified risk from the vaccine, like by orders of magnitude. So I'm very excited to get it. As far as mRNA, I think it initially sounds a little scary because it's a new technology in as far as actually being approved through like an FDA approved use, but it's been around for decades and it's been studied in lots of infections, including flu, Zika virus, a number of others. It's also been used in cancer research. So the safety has been pretty well established. The mRNA, it does enter the cell, but it doesn't enter the nucleus, right? So it doesn't interact with your DNA at all. It just goes through the transcription process, allows the protein to be transcribed, and it gets degraded. So it gets degraded, it does its job, and it's gone. I saw a tweet from Tom Frieden today, former director of the CDC, who said, think of this, it's like an email that instructs your cell how to fight how to fight COVID, and then disappears like a Snapchat. Something like that. I don't use Snapchat, so it sounds like that probably makes a lot of sense to people who use Snapchat. But no, that did sound like a nice way to frame it. It goes in, it doesn't interact with your own genetic material, and it's gone. So it's a really elegant way to do it. And it's also why they were able to do it so fast. They were able to work directly from the genetic sequence to build it, and that's why things were able to move so quickly here. So I think it's exciting for Bell's palsy. In the Moderna study, it was not seen in the Pfizer study. In the Moderna study, there were 3 cases in the treatment arm and 1 case in the placebo arm. So out of 30,000 patients. So that's what it is. It's going to take a while to learn whether that's actually an association or not.
Yeah, but the incidence of Bell's palsy is probably what, 1 in 5,000, 1 in 10,000 patients a year anyway, isn't it?
The thought is
it's not that common.
Oh, sorry. I was going to say the thought is it was pretty similar to the background incidence anyway, and so the mismatch between placebo and treatment arm was probably just incidental. But it'll take time to prove that.
There's a question here from Juan Rojas, and he said, oops, I'm sorry. He says, if you could share one strategy we as doctors could implement to encourage patients to get vaccinated, what would it be?
Well, I think the correct textbook answer is in employing kind of the behavioral psychology approach and making the right answer the easy answer. So making it the default to opt in as opposed to opt out, right? And this mostly comes from pediatrics literature, I think. But today's the day we're giving you the vaccine, as opposed to, would you like to get the vaccine today? There is actually a good body of research behind that approach and improvement in vaccination rates. I think mostly in pediatric literature, but we apply it to flu in our patients, and it's helped. My experience tells me, though, goes back to what I was saying about 5 minutes ago, which is that when the people speaking about it, the doctors, the nurses, the drivers, buy in and believe it when they've gotten it themselves, the patients follow. So, if I were running a doctor's office, I would start with making sure the other doctors in my office, the nurses, the front desk staff, all understood the COVID vaccine, all believed in it, and all got it, and then championed it with the patients.
Right.
I remember. I'm sorry, Dr. Dan.
No, go ahead. Go ahead, Faisel.
I was saying, I remember when I joined ChenMed, I was so impressed by learning some of the motivational interviewing techniques with actually having that conversation with patients and finding what is it that will drive them to make that step. Like opting in is a major, like not leaning in with an out for them, right? That was definitely one piece. But finding what motivates them to do something along those lines. I mean, I remember that was for me fascinating because it wasn't just me being like, hey, you got to get your vaccine. It was much more involved than that.
Yeah, no, I'm glad you brought that up. And Dan, you look like you want to say something. I know you're a big proponent of motivational interviewing.
Well, I am. And I think the other thing, you came up with the Spread the Love, Not the Flu campaign. And the altruism, appealing to people's altruism. So if you're not going to do it for yourself, do it for your family member. And so everybody out there who doesn't want to get the COVID vaccine, if you're not going to do it for yourself, please do it for me. Or do it for whoever you love to do that.
Yeah, I'm glad you brought that one up too. So that's why I paused when the question was, what one thing would you do? It's hard to pick one thing because we took an approach that was we're gonna do all these things at once, which did include getting the team bought in, that initial opt-in versus opt-out. We did pretty significant and heavy training and motivational interviewing, in general for our patients, but also specifically around flu vaccine, making sure everybody was bought in. We did really intentionally pick that altruistic message of spread the love instead of the more frightening message, get this or else you'll get sick. So, which one of those was most important? It's hard for me to say. It's kind of like a package deal. I don't want to give any of them up.
There's one more question here that's a good point. I mean, this is coming. The vaccine is here, and it's here at the same time we're giving the flu shots. And I don't know if we have any information about this, but is there can you give it at the same time? And if not, how long of a break do you need between one and the other, and which one should come first? I don't know. We don't have the luxury of choosing that right now, but I just wondered if you had any thoughts about that.
Yeah, well, so actually there is a recommendation on that now. And I'd point anyone who's about to start giving the vaccine just to the CDC website. They have a clinical considerations page for the Pfizer vaccine now. And I'm sure they'll be putting one up for the Moderna vaccine soon. And it goes through all these FAQs, including timing with other vaccines. And they admit there's really no data for this now, but their suggestion is that they should be separated by at least 2 weeks.
So everybody who's not in the 1A class that hasn't had a flu shot should get your flu shot right away. So you'll have the 2 weeks behind you when you get an opportunity to get the COVID vaccine.
Absolutely.
Is that a fair way to say it? So.
It is. And I actually have been telling some of the patients I've been seeing who are wanting to maybe put flu off or hesitant about flu, exactly that.
Yeah. Oh. Well, Jason, thank you so much for joining us tonight. I reached out to him over the weekend. I reached out to you over the weekend to see if you'd be available, and you were available. I just appreciate it, such short notice to be able to come and answer questions that many people have around the vaccine, to talk a little bit about where we came from, some of the thoughts you had with helping guide ChenMed through the pandemic. And finally now, the hope is in sight. My wife is excited. My family is excited. I mean, I'm telling everyone, hey, book your travel tickets now for some exotic vacations because they're incredibly discounted. And but in all seriousness, I thank you so much for joining us tonight.
Sure, thanks for having me. It's a lot of fun.
And Dr. Dan, this was a great evening. What a great night. Great questions from the audience. We really appreciate your interaction.
Yeah, very good questions, and it's exciting to have Jason with us. And be able to end the year on a positive note. I mean, COVID is on fire, and we want everybody to continue to be careful and wear their mask and do the social distancing. But hope truly is on the horizon, and it's an exciting time to see science bring this to the forefront now.
It's amazing. It is absolutely amazing when you think about like the speed at which it all happened, what's happening right now with the vaccines being distributed all around the country. I mean, I just think it's just absolutely fascinating. It'll be definitely one that the future generations will look back on and be like, wow, what a show, what an experience.
Right.
Well, to our guests and to anyone who participated, thank you so much for joining us tonight. For more information about today's topic and to explore job opportunities with ChenMed, please visit ChenMed.com. We believe access to primary care is a right, not a privilege.